Good evening. I'm attorney Lawrence Berliner. I'm an attorney whose law practice focuses on special ed law. This evening, we are joined with Jane Faherty, our co-host from the Stamford Jewish Community Center. She is the director of the JumpStart program, a preschool program, and she's an educational consultant and advocate. We are continuing our Zoom webinars. I can't believe we're well into 2 years now that we've been doing this, Jane and I. And we are continuing our webinars because we are part of a community of parents and professionals who are concerned about how to connect with one another to get through these still difficult times. For the past year, 2 years, we've been moderating a series of webinars on various topics to address concerns in these unprecedented times. The need to address the impact on your child's special education journey could not be greater, and we have brought together during the past 2 years various professionals to talk about topics of interest in the field of special education. We've gathered again tonight to address your concerns and questions, your frustrations, and hopefully we can help achieve some success to empower you for the road ahead. We have two very special guests tonight. I'll get to an introduction in a moment. Dr. Emily Cashman, who is a psychologist, who will be presenting along with Laura Noonan, who is a director of educational therapy at Freudigman and Billings in Westport. If you see on the right-hand side in the chat, all of our contact information, Jane's contact information, mine, Dr. Cashman and Laura Newman's contact information. We have some questions that came in ahead of our webinar that we'll do our best to get to them. If you're asking a question, we ask that you use the Q&A format and not the chat format to ask a question. This webinar is being recorded, and questions that are in the chat feature are recorded. Questions that go in the Q&A are not. So in an effort to preserve privacy or confidentiality, we urge you to use the Q&A feature at the bottom of your computer screen. The information provided during tonight's webinar does not constitute specific legal advice to you or your child and should not be relied upon as such. The webinar does not establish an attorney-client relationship with myself, attorney Lawrence Berliner, or Dr. Emily Cashman and the psychologist-patient relationship, or any kind of relationship with Laura Noonan or Jane Faherty. This is information, the webinars for information purposes only. By signing up, you've agreed to receive information about future webinars from either the law office of Lawrence Berliner or the Stamford Jewish Community Center. Please note that Zoom, the platform we are using, is a third-party provider. It's not an agent of or associated with the Stamford Jewish Community Center, the law office of Lawrence Berliner, Dr. Emily Cashman, or Laura Noonan. So without further ado, I will ask Jane to introduce herself and discuss any concerns since our last webinar. And then we will go into tonight's webinar, Taking Ownership of Learning. We will have several slides that our presenters will be offering. This webinar is being recorded, so we do provide a copy of the webinar following tonight's webinar to those who have registered, and I think it's also available on YouTube as well. Jane, nice to see you.
Nice to see you again, Lawrence. Thank you so much for joining us tonight, Dr. Cashman as well as Laura Noonan. So I'm Jane. I'm the director of a program called JumpStart, which is located in the Stamford JCC. And actually, we're going to be opening up a location in the Norwalk Maritime Odyssey Preschool as well in September. So the program that I primarily oversee is for 2 to 3-year-olds with developmental disabilities, and they are typically referred to the program from birth to 3 or pediatricians within the Fairfield County area. That's one hat I wear. The other hat I wear is I advocate for students both within the JumpStart program that transition into the public school if deemed eligible, and then I continue to advocate for those students through elementary, middle school, and also high school, as I've been doing it for a number of years at this point. So welcome to joining us tonight. It's been a busy PPT season, I should say, rather. We're looking forward to the new school year that's coming up, closing down and looking and reviewing, revising the current school year we've been in. I'm sure you've all been busy doing those things as well. But without further ado, Emily and Laura, it's lovely to have you here this evening. So I hand over the floor to you.
We have, just Laura is the Director of Education Therapy at Freudigman in Billings, located in Westport. She's a credentialed education therapist through the National Association of Educational Therapists. She holds all too many degrees that I can count: 2 bachelor's degrees from Cornell, 3 masters from Columbia, University of California, and most recently, Southern Connecticut State University in the field of special education with a concentration on emotional and behavioral disorders, certainly a contemporary issue for these past 2 years. As Freudigman Billings Director, she oversees the development and implementation of educational therapy sessions at the center. She works with her own students who are typically those receiving special ed services or might be in need of special education services and may have comorbid psychiatric diagnoses. When she's not with her students, she enjoys kayaking on the Connecticut shoreline, writing, and of course, reading. And so she'll tell us a little bit more about herself. Dr. Cashman, I've known for, I think we figured out, more than 10 years now. She's a licensed clinical psychologist. She's also located in Westport. In full disclosure, all 3 of us have share offices in the same office complex located in Westport at 1720 Post Road East in Westport. It's just coincidental that we're all have our professional offices there. Dr. Cashman, as I mentioned, has a PhD, a doctor of psychology, and she will go over her background and credentials. We're going to discuss various issues about psychological assessments, how that informs learning profiles, education therapy, which is a data-driven intervention, building team-based approaches with community supports, and helping students take ownership and self-determination, which is especially critical for the older students, meaning those in high school and those who are about to transition from high school into post-secondary educational opportunities. So without further ado, I want to turn this over to Laura and Emily, and we look forward to a very informative presentation this evening.
All right, so I'm going to share my screen and hopefully this will work. All right, how's that, everyone? Good? Good, okay. All right, so as Larry said, thank you so much for that very kind introduction. We're going to talk tonight about psychoeducational assessments, which is Emily's side of the field, and educational therapy solutions, which is my side of the field. As Attorney Berliner said, Dr. Cashman has his PsyD from East Shiva, is a mom of 3, and ran the Boston Marathon this week. I'm going to continue to annoy her by telling everyone that. And I have a master's of special ed, and I've been with Freudigman Billings since 2007. And yes, I read far too many books. So I wanted to start by talking about what educational therapy is. it's the question I get the most commonly. Most people don't know the term. It's more prevalent in the West Coast. Most people don't even know that there is a field of educational therapy. Briefly, it's an intervention for students with learning differences or challenges in school. We meet with students one-on-one, and we provide differentiated instruction, strategies, skills, and remediation. Sometimes I say it's a lot like you take a school psychologist and a school counselor and you kind of smush them into one person. So there's aspects of school psychology, interpreting assessments, developing modifications and accommodations, promoting positive behavior and mental health. But there's also a lot of aspects that have to do with special education. So we're teachers, we're educators. We teach with the curriculum and content knowledge. We understand student behaviors. Our practice alone sees 400 high school age kids a week, 400 to 500 actually. It's not dissimilar actually to services students might receive in special education. It's typically after school though. There are some facets that are things that make ed therapy unique, things that you wouldn't necessarily see in a school setting. One interesting piece, which we'll talk a lot more about later, is our desire to make ourselves obsolete. We really want to teach self-determination and independence to our students. We use a strength-based approach. I'm going to talk a lot about that. And we create real therapeutic relationships. This is especially important when you work with adolescents. They can tell when you're not real. We teach all classes. So my team teaches all subjects. And of course we teach self-determination, independence, and we use current work in our work. We use current work to process academic struggle. It's often mistaken for tutoring. And a lot of our kids come out and they say it was tutoring, and that's okay if the kids think that. It is different from tutoring. Tutoring typically uses instructional methods that are similar to a classroom setting and focuses on current homework, but only the current homework. And it really just teaches and reteaches one subject. And it only really focuses on the student. And it's typically not informed by assessment. So it's different in that way. So I just wanted to preface by sort of orienting everybody to what ed therapy is, because it is a bit of an unknown in our community. So the topics we're going to cover tonight are educational evaluations, how we use those to build a team of individuals, a community of support, interventions on the ed therapy side, and then how to develop ownership and self-determination, especially important, as Attorney Berliner said, for our older students. And I want to give everyone here permission to not know a lot of the terms we're using. A lot of this might be unfamiliar to you. A lot of us don't think about psychoeducation in our day-to-day lives. So as we're talking, just think of a student, and imagine them going through this sequence of interventions, and it might help to personalize it. So I'll turn this over to Dr. Cashman at this point, because she's going to speak about what we look at in a typical psychoed eval.
Thank you, Laura, and thank you, Larry, for the introduction. So when I get a student, when I get a referral for a student, the first thing I want to know is what are the questions that a parent has? What are the questions that the referring person has? So that could be someone like Laura, it could be a school, it could be a therapist. And so I want to really tailor the evaluation to answer whatever specific questions I can. And while there are sort of gold standard areas of assessment, I do like to kind of, again, try to really tailor the intervention. Or the assessment. I always look at IQ. A lot of people talk about IQ, and I look at intelligence really as sort of a jumping off place to see what is this individual, like what's their raw material. So how do they problem solve? How do they reason with words? What's their vocabulary like? How do they categorize things and generalize things? The other part of intelligence is something called working memory, which has gotten a lot of attention in recent years. And it's sort of a short-term memory and sequencing. And then I look at processing. That's all part of intelligence. And I think, in recent years, the term processing has gotten a lot of attention to, and oftentimes parents call me and say, I think my child has a processing problem. That can mean 15 different things. So, I do look at processing speed, which is sort of how efficient can a student be. But then there are also other areas of processing, which we can talk about. I always look at academic achievement. So reading, writing, math, some aspects of language. And the idea is that we want, if you think about kind of a balancing scale, we want intellect and academic aptitude or achievement to be about even. So if we have a really bright child who is really struggling with reading, then I start asking, all right, is this a learning disability that requires intervention and attention? So ultimately, we want all those scores to be kind of within the same range. I look at lots of different aspects of memory. Oftentimes a parent will say to me, my child has a fantastic memory, and they do for certain things. But in a classroom, you have to remember what the teacher's saying. You have to remember what you're seeing on the smartboard. You have to store information and then recall it or recognize it for a test. And I would say 99% of the kids I see have a weakness in one of those areas. So then we have to kind of figure out, how do we support that weakness? And then, of course, we look at attention and what's called executive functioning, or think of it kind of like being the manager of your world. So how do you do things independently, organize, start tasks, regulate your behavior, finish tasks, sustain attention and concentration. And one thing that I really try to tease out is the difference between ability and performance. So there are times kids come to me and they are absolutely inattentive and distracted and disorganized, but that doesn't mean they have ADHD. And that's something I look at very closely with students. We have to find kind of the reasons why there may be problems with attention if it's not sort of brain-based attention disorder. And then I look pretty closely at psychological functioning. So I want to look at risk factors. I want to look at mood. And for adolescents, it's so tricky because adolescents can be a pain, and they can be moody, and they can be rude, and all those things. So my job is to really kind of figure out, is this, especially for teenagers, is this behavior, mood, attitude, whatever it is this within the norm of what we expect for someone this age, or is it outside the norm? So taking a really close look, because psychological functioning impacts learning, and vice versa. So trying to kind of look at everything comprehensively to figure out where there might need to be support and intervention is important. So Laura, you want me to talk a little bit about learning profiles, or do you want to?
No, you can take this one.
Okay. Sure. So after doing a full assessment, and that can take, it depends on the kid. It can take 6 hours. I've had some kids it takes 12. It really is unique to each student and their style, and what they need, what kind of tests they need. And at the end of the assessment, we do kind of talk about a learning profile. So every student has strengths and weaknesses, and some students have actual diagnosable problems like dyslexia or attention deficit disorder, or a variety of other things. On the psychological side, someone might have clinical anxiety or a mood disorder like depression, or a variety of other things. So all the data is sort of taken together and analyzed to create a profile. So does this student have strong verbal skills and weak visual skills, right? Or I see a lot of students who are quite bright and they are verbally astute, but they are so slow to get things done. And that asymmetry, while it may not be a learning disability, is indeed disabling. If you have a super bright kid who can't seem to get their homework in on time, or they're always running out of time on a test, or I had a student a couple of years ago that Laura and I worked with together who, as a freshman, was spending 8 or 9 hours a night on homework. Super bright kid, but processing speed was a problem. So I really want to look for that asymmetry if it exists. And then I talked a little bit about memory and trying to kind of really figure out, how does this child or adolescent learn? Do they learn by seeing things or hearing things or having things repeated, having things clarified? How does this person really learn best so that teachers, tutors, parents can really teach to the student instead of trying to fit everybody into a little box. And you know, the other one that comes up that I look for, there are times that kids come in and they may be super bright and they may be a child with autism. And how does that impact learning and social communication and all of those things? So I'm really looking at lots of different things to create a profile and kind of a roadmap for families about, you know, how do we support our child? And if needed, where else do we go? Right? So like, I'm not a speech therapist. And if I suspect a speech problem, I am going to send a parent to someone who specializes in speech. So part of that can be an outcome as well.
Yeah, and that's actually the next thing we were going to talk about, is that's often the very first step after I get an evaluation from Dr. Cashman, is I'll say, okay, who else do we need to get on our team? And a lot of the time we follow up with other clinicians. I was talking to a parent this morning and she was confused why an evaluation would create more evaluations. And I said, well, because, you know, Emily's testing doesn't really determine causality. It doesn't really determine the root cause of something. Often evaluation leads us to some areas we want to follow up on. If there's a visual processing issue, we want to make sure we get an updated vision test. Auditory processing, verbal skills, we want to talk to an audiologist. It's important to differentiate for us if it's a sensory system that would benefit from some assistive technology, like a hearing aid or glasses. Same goes with language skills. If it's something that requires a writing tutor or a language and speech and language pathologist. Some of these people we only meet with once, like a speech therapist, or, you know, just to rule in or rule out issues. Some people we might meet with multiple times, and they might be an ongoing team member. So you might meet with a pediatrician once to get updated testing, blood work, diagnostic yearly checkup, and you might have a therapist that you meet with weekly. When there are a group of clinicians that are working with the same student, we really try to connect with them weekly at best, or monthly at worst, to ensure that our work is always aligned. Just for example, the speech and language pathologist working with my 9th grade student right now who has a reading comprehension and language disorder, she needs to know they're reading Macbeth, so she can support that vocabulary. The psychologist working with my student with ADHD and OCD needs to know if she's falling behind in her college coursework, and all of the associated things that go with OCD and living in a college dormitory. So we keep in very close contact, and that begins sort of to build the team around the student. Another incredibly powerful team member is an educational advocate and attorney, which is one of the reasons why we're meeting with this group tonight. And we've gotten to work with this group. Most of us have never had to navigate the legal side of the school system. I've listed just a few of the things that can come up when you have a student in special ed, and each one of these things is a major undertaking, and requires a huge amount of knowledge base and an effort on an attorney or an advocate's part. So we want to have them on our team, and we want to be communicating with them. So Dr. Cashman would be communicating about what she's seeing in the evaluation. I'm communicating with what I'm seeing in the classroom or in the one-on-one setting. And we use that to tailor the accommodations. Because the most common issue we work with advocates is on FAPE, making sure our students have fair access to public education. A lot of the students we see in educational therapy arrive at our door with no services. They may have tried to get services in public schools. They may have needed them for many years. They just may not have qualified for various reasons. Very often I'll be taking case history and I'll find out that a student had RTI in elementary school. And once they met benchmarks, they were exited from that support. When we have a psychoeducational eval from Dr. Cashman or somebody else in the community, we can find out that a student has a disability status. And in that case, an advocate would advise a family on what supplemental documentation they need, if any, and go with them to the school to discuss what their legal rights are to ensure that the proper 504 plan or IEP is crafted. One note I always like to throw in when I show this slide, people always ask me, what is the difference between accommodation and remediation? What's the difference between a 504 and an IEP? I've literally heard parents refer to an IEP as, the platinum plan, the platinum card, and it's not that. Accommodation just allows a student to learn the same material in a different way. Modification changes what a student is taught or what a student is expected to learn, and it's good to kind of differentiate those when you're looking at what would be a best for the student's needs. So why is it important to have a treatment alliance? Well, basically, because if you think about all the adults a student is in contact with on a daily basis, it's a lot of adults. And our kids in our service are not always reliable reporters. These are the kids that get in the car at the end of a session and when they say, what did you do in session? They say, my homework. And, the real answer is we practice sequencing skills on multi-step assignments like a lab report, and we worked on executive functioning, on a study plan for an independent review for tomorrow's math test. So it's important that the adults supporting the child all have the same information at the same time. And truthfully, the goal of a good ed therapist is to be a case manager. It's to coordinate all of these services and to make sure that all of the people that the student needs is in place, and make sure that the team is functioning properly. That's really how I see my role in this process. And it's not one thing that gets a student to where they want to go. And by the way, just because the slide says A+, it's not necessarily an A+ that they want to get to. It's a third educational supports, I feel like. It's skills, it's strategies, it's executive functioning, it's content support. Sometimes it's supported study hall. It's a third clinical supports, medication, therapy, speech and language, OT, PT. And it's a third school supports, modifications and accommodations. I always sort of think of it as a stool with 3 legs. If we don't have one leg in place, the stool is not going to be as strong. And the ultimate goal is that they have balance. It's not all one thing. And evidence shows that when you have skills in conjunction with clinical supports, it's effective 90% of the time. I do like to pause and just talk about motivation before we talk about some case studies. A big reason people contact myself and contact Dr. Cashman is they say they have concerns about their students' motivation. We don't actually tend to focus on this in our work because our fundamental belief is that when children can do something, they will do it. When a student isn't able to do something, we always ask if it's something they've even been taught. You'd be surprised the gaps in understanding we encounter, especially after the last 2 years of online learning. Evidence sort of shows that when a student only has a learning disability, it's not often recognized as a learning disability without an evaluation. When a student has a learning disability and issues with production, like Dr. Cashman was talking about, it's usually recognized fairly quickly as a learning disability. What we see a lot, especially in our adolescents, are production issues. And these are usually attributed to a lack of motivation, character flaws, or behavior problems. And often it really couldn't be further from the truth. Sometimes I'll sit with a 14-year-old or 15-year-old and read a paragraph with them and realize they're not producing work because they can't decode the words on the page. So we don't believe kids are lazy. We don't use that word, and it's sort of banned from our office, frankly. All right, so I want to talk about a couple of case studies very briefly, how we take a learning profile from Dr. Cashman and what interventions for behavior and grades would look like. So after school, we change hats, we become teachers, we become instructors. The structure of every session at our center follows these levels of supports. The student comes in, we log into their portals, Google Classroom, PowerSchool, Schoology, Canvas. The list could keep us here all night. We sort through what's happening since last we met, what's happening right now, what's going to happen. We might find an assignment that's been overlooked, not handed in, not started. We make a plan. We might find, quiz didn't go well, so we debrief that and we practice problem solving and perspective taking. We set some goals for what might need to happen next time, what behaviors might need to change to build sort of that self-determination, that self-regulation. We might find a teacher hasn't put in a grade. So we might email the teacher together and encourage them to practice self-advocacy. Notice how often I'm using the word self. That's a really big focus for us. The goal is over time, and is that we put them in the driver's seat. If they've seen us do this multiple times, we start to say, you know what I'm going to say. Right, log into PowerSchool. So the goal is that we want to turn the task over to them as quickly as possible, and then observe and make sure that they can plan and make a list for the week. For some kids, that's their weakness, and that is 9/10 of the hour. For others, it takes about 15 minutes, and then we pivot to specialized skill sets, we choose a big ticket item for the week. It's an English essay. We talk about a good strategy for writing. If it's a bio quiz or a math quiz, we talk about study strategy, memory strategies. The great thing about our ed therapy staff is they work on all the courses from elementary school math to AP World History. And then the last layer of support is remediation. The goal is to find any gaps in a student's knowledge while we're working, and take a few minutes just to remediate their understanding. And this could look like something really in-depth, like weekly spelling drills for a student who's not mastered internal vowel phonemes. And it might be something smaller, like just saying, hey, do you want to learn the 7 comma rules that you commonly see in English? And none of our students seem to know comma rules, so we teach a lot of comma rules. So here's a case example of a student. It's sort of an amalgam of multiple students that I've worked with over the years. But when I think about this student, one kid in particular comes to mind. She's currently a junior, and I've worked with her since 8th grade. She's made a great deal of progress in our time together. I actually only see her every other week now. I do check her grades more frequently than that. And her strength is visual reasoning. She has great visual recognition and recall. She's got really good pattern recognition. She does math once, she's got it. Her weakness is she has low processing speed. It really takes her a long time to encode and understand information. She does have an ADHD diagnosis, unfortunately, in addition. So the amount of time it takes her to encode information is really difficult for her to maintain focus for that long period of time. And she does tend to sort of drift off a task and then forget that it was started. When I first met her, she was in a learning environment where all of her classes had daily homework, and that was not a good fit for her learning style. So one of the things that we did was we harnessed her visual strength. We're a strength-based approach. We built metacognition, and we talked a lot about her strength as her superpower. We always talk about the things kids are good at. They don't need to hear more about what they're not good at. We used her visual memory to design schedules and structures and lists. She's really good at keeping lists right now. She uses a notebook, and she always has her list, and she checks it off, and it's kind of pretty. She uses different colors. She uses visual reminders on her phone for small assignments. We set timers, and we use the reminder app to go off during different classes, so she remembers to hand in homework. We have strengthened her engagement with reading so greatly by getting her invested in films. And so if she reads a book, we watch the movie. She reads a play, we watch the play. We draw tons of diagrams. We chart out her grades so she can visually see her past performance. And then when we have a moment, we address the weaknesses. We use movement and fidgets to send alertness signals to her brain. We use timers. So she has an internal sense of passing of time because she really doesn't know the difference sometimes, I think, between 20 minutes and an hour and 20 minutes. We rehearse taking longer tests with doing some timing drills. We have a timer in her computer that we set when she does work. And we have chosen classes that are better suited for her learning style. They don't have small daily assignments. They have tests where she can just sit down and demonstrate her knowledge. They have quizzes weekly, and she does really well on those. She's up at about sort of a B average now from when we met her, and she was really kind of at an F average for all of her classes. Just showing her how to study with her visual strengths. Another example, and I won't spend too long on these, but this reminds me a lot of a student I have right now at Ludlow. And she is having a really tough time remote learning math, a lot of difficulties for her, but boy, does she have good focus. This is the most diligent kid on the face of the earth. She is organized. She is detail oriented. She does really well with detailed subjects like math and science. She can persist at tasks for a long period of time. She does not have good verbal reasoning, though. It takes her a long time to read and understand things. She doesn't have depthful understanding when she reads, and she does her papers pretty late at night. The environment she's in, her courses have a pretty fast pace, and they have a lot of reading quizzes, and that is really tough for her. At least it was freshman year. Right now, we're working on using her focus and her detailed organization strengths. We've improved her essay grades with writing organizers and rubrics. She can fill out a rubric for every single part of an essay, and it goes really, really well. She meets with faculty to demonstrate how much she understands and to check for comprehension. And she is just a teacher's pet. They build a relationship with her. They love her. They want to help her. We've paired readings with visuals, like we do with the last student I talked about. And we've developed strategies that she can use to increase wait time for responses when she can't think of an answer. In the summertime, she actually lets us do Orton-Gillingham remediation. And so we do remediate phonemic awareness with her. And we rehearse oral expression in session. And we're going to take ASL next year for a foreign language for her dyslexia diagnosis. And she does projects. She's amazing at projects. I probably will skip over this because I don't want to take up too much time, but this is a kind of the flip side. This is a kid with strong verbal reasoning, and we used verbal strengths to remediate this student's performance in school. And then the last piece I want to talk about is sort of what's at the heart of all of this. It's this philosophy that we're not going to college with our students. We want to give them the skills they need to be independent and take ownership of their educational experiences. One thing we always discuss in our work is they have so many resources that they don't know about. First and foremost, we want them to build real relationships with their teachers. When a student meets with a teacher, they feel more comfortable asking questions and going to them for help. They can always contact us, but we don't know the curriculum as intimately as their teacher. And when they meet with the teacher for extra help, it helps the teacher understand where their skills are. It gives them a formative assessment of their ability. A lot of my students with language disorders struggle to meet with their teachers, but when they do, the teachers realize they're not quiet because it's a lack of engagement. They're quiet because it's a true weakness in their learning. A lot of teachers give informal accommodations. But when we're sitting around the table at a PPT, there's no documentation. So we help students to let teachers know when they're struggling to complete a task in the allotted time and to thank them in an email when the teacher's given them extra time. So we have a paper trail. Other than being polite, it demonstrates, how to write a thank you note, but it also, it's something we can say. We have a history that the student has consistently needed extra time on math assessments. And then finally, so many of our students struggle with reading and writing, and there's so many assistive technologies that we use with them. and they find it incredibly useful. Lastly, we build ownership by building metacognition. That is probably the core of our work as ed therapists. We want our students to actually understand their learning profile at an age appropriate level. We don't use diagnoses, we don't share testing with them, and we don't talk about numbers and IQs, but we want them to know their strengths and to have some awareness of the areas where they're not as strong. We want them to track their assignments eventually, not the adults in their lives. And they should know how to, what their accommodations are, how they function, how to self-advocate for them, how to negotiate this with the school to use them, because when they get to college, they will have to self-identify as having a disability if they do have one. Knowing your strengths and weaknesses is not just something for high school, it's something for life. It helps you in a relationship. It helps you in your first job, helps you in your current job. It helps you across the board. And even though IDEA goes away, the Individuals with Disabilities Education Act, when kids graduate from high school, they need to be prepared for a world where the ADA is going to take over. I'd be a bad director if I didn't plug for my team. This is my team. Christmas. These are our sort of our mottos. We build trust. We encourage engagement. We build skills. We look for mastery whenever we can, and we look for love of learning. We teach how to learn. We want to build independence and ownership. One thing that's a little bit different about our ed therapy, just for 2 seconds, is we have a sort of unique model of ed therapy. There's a lot of people who are ed therapists, actually. You can go on the AET website, the national organization, you'll find a whole list of ed therapists. You will not see a team of ed therapists. We, for some reason, seem to be kind of an outlier. We work as a team, and it's really our superpower. When I find that, we're 60% male and 60% of my staff is male, that's a really good fit. We want young men to have young men mentors, and that we want them to see themselves in the adult in front of them. And I'm not the perfect match for every kid. I need to, share with my team. Sometimes they have a better fit, or sometimes they have more content knowledge in a particular area. I can't remediate everything. So I have a team of about 12 people, and all ages, all backgrounds, from all over the country. And they're a really amazing group of individuals. We also have this Clubhouse model, which, as Larry said, everybody happens to work in this building, so they know what chaos we bring to it. Just to tell you a tiny bit, because this is something that's really near and dear to my heart. It's based on the Clubhouse model of psychosocial rehabilitation. You can go on Wikipedia and read about this, but basically the idea is it builds on people's strengths to provide mutual support, along with professional staff support for people to receive vocational training, educational opportunities, and social support. So coming to our center is open to anyone who wants to do so. Anyone who wants to do better in school, it's voluntary, it never expires. You can bring your friend. In contrast to traditional tutoring centers or treatment centers, our kids are our students. They're not patients, they're not clients. We have activities that focus on strengths, abilities, and not weakness. The center is community-based, and our goal is just to help members become a society and find a sense of belonging. A lot of our students haven't found belonging in high school. And so if that's the case, they can find belonging in our group. We have evening programs until 10 o'clock at night, and kids can find a place to go. We have 7 therapy dogs that wander around. We have a lot of Doritos. So be careful what couch you sit on. You'll get a dog and some Dorito dust. And, it's inclusive. There are all kinds of kids there. There are the leaders of all the varsity teams. There are valedictorians, and there are kids who have school refusal. And I believe very strongly in inclusion, and that's very intentional. There's no, ed therapy wing. It's all mixed together. There's one kid getting SAT prep in one room and one kid getting ed therapy in the next room, which is great because when our kids graduate from ed therapy, if they need SAT prep, they can go next door to the next room, or they even stay with us. All of our ed therapists also do test prep and college planning services. So we want to have continuity of service, just kind of one-stop center. So that is, I hope it's been helpful and informative. As you can probably tell, this is a method of working with students I'm really passionate about. I've been doing this for 18 years, and I'm a huge advocate for this type of work. I think it's really effective, and it's a way to give kids a voice and ownership of their learning. So thank you everyone for listening.
Thank you. That actually parlays nicely into one of the questions we were asked during the webinar presentation.
Sure.
So somebody posted the question, the team approach sounds wonderful. How do you manage having to be part of or to communicate with all the different teams you assemble? Or do each of you in the group work together as a team for multiple clients? So how does the team approach work and function?
So there's the internal team and then there's the external team. So internally we meet, we have a case study model. So we meet, we case review, or I case review as the director, every student every week. So I have an hour with each of my team members during the school day. Thank goodness for the school day, because I wouldn't be able to actually do this. So while the kids are in school, we're in meetings and we talk about every student every week. We look at grades, we look at metrics, we look at internal goals, and we look at how the student is responding. And then we have a group case study model every week, sort of a clinical model where we talk about a kid that's succeeding and a kid that's struggling, and we problem solve, and we talk internally about, what are we missing? And sometimes it could be as simple as, oh my goodness, this kid has not been coming during all of ski season. He needs to come more frequently. Sometimes it's, oh my goodness, this kid sleeps 14 hours a day. I think he needs to go to get his, annual checkup. And we find out he's had an undiagnosed sinus infection for 2 years. So, and sometimes it's just he needs a new tutor now. He's sort of maxed out what this person can give him, and he needs somebody else. Externally, so that's inside the building. Externally, we spend a lot of time just having phone calls. We get group phone calls together with parents, and Dr. Cashman and I will get on the same phone call with a parent. Probably 2 hours a week, or 2 hours, a day, I spend on the phone with different stakeholders in various conference calls. We have an internal parent portal where parents can log in and they can see our case notes for what happens in sessions. They can share that with any other providers that a student's working with. And also we have the students write emails to the team in sessions when it's developmentally appropriate. So at the end of a session, we'll actually take notes and we'll say, okay, here's what we did, here's what we need to do. And then we'll put mom, dad, Laura, Dr. Cashman, therapist, school psychologist, study skills teacher, anybody else who needs to go on that list. And then everybody gets what the student worked on that week, and everybody knows what the goals are. There are some kids who are getting daily emails because that's just the stage they're at. And there are some kids that are getting, weekly emails. So a lot of emails and phone calls and communications is the short answer.
I would also, just to add to that quickly, I think it, for each student it's unique, but I'm just thinking of sort of a practical example where maybe I do an assessment and I refer the individual to Laura's, to F&B, and Laura has the data and Laura and I talk about the data, and then we both meet with the parent. And then as the team kind of gets assembled, oftentimes, I think Laura and I are both pretty efficient. So it may be that 4 people are on a call together and one point person gives all that information to the parent. So we try to all talk to everybody in an efficient way, but it starts with the referral comes to me or the referral goes to Laura, and then we kind of assemble the team and make sure we're all communicating as efficiently as possible. And the ed therapists know the data. So if I say to them, this person's score in visual reasoning is X, they know what that means, and can also spend time explaining that and what remediation looks like to a family after I've done the assessment.
I just wanted to go back to one of Laura's slides on the informal accommodations, going for extra help, asking for extra time, checking work in process. and assistive technology, I can't stress how important those skills are, not only for today, but for life after high school, because these are the skills, the executive function, the independence that students will need in college, because there's a paragon shift from high school to college that often parents don't realize, and more specifically, their children don't realize when they go off to college. And one of the questions we had tonight, is it true that my child will have to advocate for himself completely independent once he enters college? The answer is absolutely yes. Number one, they're 18. That's the age of majority. Number two, there are no IEPs in college. If they had an IEP in high school, there are not any IEPs in college. You may have accommodations similar to a 504 plan. And that's why having the self-advocacy, the self-monitoring skills, checking your work in progress, knowing the resources, meeting with a professor, these are the skills you start working on in high school or before high school, because that will lead to your success after your post-secondary education success after high school.
We spend a lot of time when we exit a student from ed therapy. This is actually sort of the season. All of our kids are getting college acceptances, thankfully, and they're accepting and they're putting down their deposits. And so starting like Monday, we're going to be spending a lot of time sitting down with our kids and saying, okay, now, let's talk about what are your accommodations right now? What do you like? What do you use? And what do you get in college? What do you like? What do you think you are going to use? Let's talk about housing, let's look up disability services, what is out there. And you have to be able to sort of talk about these things, and they're very nervous. There's an interview usually at disability services, and I say, I'll be on the call if you want me to. I'm not going to say anything. I'm just going to sit there and be quiet, and I'll remind you if you forget something. And at the end of the call, they always say, oh, that went so much better than I thought it would. I was so scared. That person was actually okay. And, I actually feel like this is going to be really helpful. And I feel they feel very validated and very empowered at the end of that process. And I say, remember that person you talked to. I really want you to go talk to them in the fall when I'm not there and you're struggling with something. Just today, I had a college student in my office, and I was like, okay, this is when we email disability services. So it's a big part of how kids leave the ed therapy process.
I also know too that some students that have gone off and have continued to use the relationship they have with their private practitioner that might be their therapist, and the virtue of remote access and Zoom and those platforms is some of those students have continued to contact their therapist in those moments where they felt particularly anxious or stressed during that college process, once they are actually, during their semester time. So has also been a value to this remote platform that has enabled some students when leaving home to continue to have that connection, that support network, travel with them despite the distances. Emily, how have you found that with some of your clients?
So it does, I won't get into too much of the ethical and legal stuff, but it does vary state to state on who you're really allowed to see. I've been lucky with the kids that I have seen. One thing that's been really wonderful is I've had the opportunity to evaluate some students that I never would have had the opportunity to evaluate. So like I had a student who was doing really well and her grades started declining end of October freshman year. And I was able to do a remote evaluation. So she didn't have to leave school. She was able to see me in between classes. We did some work on the weekends. And then we kind of made a plan with the Office of Disabilities at that school to get her the accommodations she needed. And in terms of therapy, I have a lot of kids who therapy is maybe 20% of what I do at this point, but it's been really wonderful. I have some kids who, instead of having to get them someone, and Laura and these guys used to do a lot of like finding someone else once they get to location B. With a lot of these students, I can just continue care, which is really wonderful, I think, especially kids that I've been seeing on and off for a long time. So the remote platform has been, I think, really advantageous in that way, and has allowed students access to things that they might not otherwise have access to.
We had a question come in for you, Dr. Cashman. Are there specific things that you're looking for when you first meet a parent? Are there referral questions? Is there a questionnaire? What kind of information background information, school reports, other reports are you seeking before you start doing your own heavy lifting with the child or the student?
Oh, that really depends on the student. I've had some parents come in and say, hey, my child has had 4 other evaluations. They have had an IEP for 4 years. And I have a stack of paperwork from the floor to the ceiling, then I'm going to review all of that. If I have a student coming in who's never had an evaluation, then I am going to maybe ask for recent report cards. I may ask for like the OLSAT scores or MAPS testing, or sometimes, not always. I'm always looking for a good history, regardless of if the student has been evaluated or not. So I spend an hour and a half talking with parents before even meeting the student, just about their strengths, their weaknesses, their social life, their extracurriculars. And sometimes, more recently, actually, I send a dreaded form to parents that takes a really long time to fill out, about school history, medical history, developmental history, social history. So I want as much information as possible so that I can really tailor the evaluation to meet the needs of the student and the family.
And what's the difference between the evaluations you might conduct versus those completed by a school district?
So that's a great question. The school district, and this is sort of a generalization, but often they are going to look at IQ, academic achievement, some aspects of attention. And in terms of the psychological functioning, most psychologists in the school, not all, but most have their master's in school psychology. So they actually aren't trained to do some of the psychological assessments that a clinical psychologist is trained to do. Now, I know in Westport, for example, there are a couple of licensed clinical psychologists in the elementary school, so they would be able to do some of that testing. But the private evaluation is more comprehensive, I would say, especially in terms of the psychological piece. There's a lot more information there.
One question we received was a parent who's new to the process, and they'd love information on how to get the school to agree to do the initial evaluation. I always start with, you have to ask for it. You have to ask for a referral to special education. And if we agree, it's called a PPT, a pupil planning team meeting. Here in Connecticut, it's a CSE. In New York and other states call it something else. These are the meetings to discuss a referral and a development of a plan to evaluate the child's suspected disabilities, as pointed out, identifying areas of strengths and identifying areas of weakness. Do either of you get involved with that initial process of referrals or working with school districts on behalf of your students or your patients?
Yeah, very frequently we work with parents that are just beginning the process. Frankly, many of our families come to us not having really had any contact with the school at all, besides, an occasional call home from a teacher. And so we do say, this is how the process works. We do a lot of parent education about how to interact with the school and request an initial PPT. We certainly, when we think that it's necessary, can go and provide anecdotal information about the student's performance. We often will say, a better person to bring with you would be an attorney at this point, or an advocate. So sometimes it's us, sometimes it's somebody like one of you guys. And we definitely spend a lot of time with our parents talking about, why they might want to get a school evaluation, why they might want to get a private evaluation, and what would be the most expedient way and what would be the most thorough way to get answers to questions.
So this was a question that we had this evening from somebody watching the webinar. Because you mentioned that the field isn't as commonly used over on this coast as it is on the West Coast, how receptive have school districts been on this coast with regard to listening and following through on your recommendations that you make?
So we've had really good success. I still get, when I read the IEP after the fact, I still get called a tutor. So other than that, it goes really well. I think, when we're sitting around the table, or when we're on the phone with a school professional, and we speak about how deeply we know our students, and we understand, why they struggled with that one paragraph, or, why that operation with radicals was just so, we can speak about their learning process at a level of detail that I think really resonates with people who are other educators. We, first and foremost, we're teachers. And so we can speak about our kids with thoughtfulness and detail. And I think they respond really well. And our main goal is really to help them. Our goal as ed therapists is to help teachers in the school system understand the student, understand how we can support them outside during the day. We have the easier job. They have the much harder job. They have 20 kids in every hour. We have one. So we really want to position ourselves always as their support. And so when we do so, and we speak about the kid, and they're like, oh yeah, that is the kid in my class. We've had really good success. We just have to make sure that, we don't sort of put ourselves in that tutor category, because I think there is a stigma around tutoring. And I think a lot of teachers just feel that it is a Band-Aid or it's a crutch. And we do try to make sure that we explain that that's not our goal. We are really trying to get students to self-determination and independence. And then they seem to be very, very receptive.
We have a couple of questions of sort of the flip side of the same coin. One side of the coin is when to request evaluations, and the flip side of that is how do we get additional testing and evaluations? Can either of you help with that, providing an answer?
So I'm not sure if I'm going to answer this correctly, because I'm a little bit confused by the question, but I'm going to try. I think additional testing, when I hear that, I think, all right, there's a student who's had an evaluation through the school district and the parents want more information. So if that's the question, then that's sort of a whole different process in terms of where I step in, because I'm not going to redo something that was just done a month ago, right? So I'm going to look at what the school has done and review it and meet with the parents and either make a recommendation that we wait a year in some cases so that I can do a comprehensive reevaluation, or once in a while I can kind of add some things in, do a little bit of additional testing, but more often than not, it is waiting a bit to do a comprehensive evaluation privately. If they're asking about additional testing in terms of like speech and language or something of that nature, that's a referral that I make, or that Laura makes. And then the first part of the question, I'm sorry, Attorney Berliner.
Is there a point in time that somebody should be asking or requesting an evaluation? Like how soon or late?
Yeah, well, so I'm totally biased because I think that testing can help every student, right? So my kids have been tested. I think that, you get a profile. So even if your child has no learning disability and they are perfectly stable emotionally and healthy, there are still strengths and weaknesses. Now that's not necessarily realistic. So I guess the answer is, when you start to have concerns, trust yourself that you have concerns. And I always think it's better to get more information early than to wait. So I've had kids come in to see me as juniors in high school who I've diagnosed with dyslexia, and they have been struggling along. And because they're so bright, no one's really noticed, or I have kids who've been treated for ADHD for years, but that's not really what it is. So we want to make sure we know the profile, we have an accurate diagnosis, and we can make appropriate recommendations. So if you see something that makes you wonder what's going on, or if a student is struggling in one area, or over time in elementary school, they're right at that meets expectations level, or the school is saying they're meeting great expectations, but something's not quite right, better to get an evaluation and really sort it out early. The earlier I see kids, the better for long-term success.
And I can also add value to that, because we see 400 to 500 kids a week. And so I can say, we're fine. Like, we're absolutely fine. This is normative 8th grade boy. You've got an 8th grade boy living in your house, or this is starting to be different than what we typically see. I would recommend digging a little bit further here. And we really don't always send everyone for testing. It would be impractical. So it is not every student that we refer, and we can help make that differentiation and when to do it. Is it this year, or do we just wait a year or so? It's not always right this instance.
The other thing that I know with testing with parents that I typically have worked with, and that I typically meet them when they're at the beginning of their journey, and if they get IQ testing. So some parents get very scared when they see an IQ score. So in your opinion, don't you think at that point it's very important to take time for the parents to sit down with someone such as yourself, Laura, or you, Dr. Cashman, to really understand what the IQ score means? Because a raw score doesn't really tell you much, it doesn't give you the full picture of that child. What advice do you have for parents with regard to looking at just the IQ score?
So I would say, don't ever just look at the IQ score. I have a student right now, actually, who Laura and I were talking about, who historically has demonstrated really strong academic skills and is currently failing. And I gave him an IQ test, and it does not show what this boy can do, right? So IQ tests are really good reflections of what the student is capable of now. And if there are no other factors, IQ will remain stable over time. But the minute you throw in anxiety, a learning disorder, attentional problems, mood issues, it's going to impact IQ. I think the most important thing is that, a lot of times parents will come to me and they have a document from the school and they say, oh, my son was tested in 5th grade and, here's his IQ. More often than not, the school does not really thoroughly explain what all of that means. And it's so important to talk to somebody who really knows what all of that means and can sit down with you, even if it's page by page, number by number, and say, here's what this means. And the other thing about IQ is I would never, ever give an IQ test in isolation. It's just not, it's a small fraction of a whole child.
Mm-hmm.
And we do a lot of that parent education as well. It's not just me over there. I mean, the company is called Freudigman in Billings because it was started by Dr. Kim Freudigman, who is a developmental psychologist and was on Yale Child Study Center faculty. And she's insanely knowledgeable about these things and spends pretty much all of her day just helping parents understand, you know, what all these numbers mean and walking them through these tests. So I do not even do most of that heavy lifting at our building, but we have lots of resources to help parents understand that.
We're coming close to our ending point, but we have 3 questions, and I'm going to give short answers. And if Jane, Dr. Cashman, or Laura want to add to them, please do. My son is going to have an evaluation for ASD. Will this evaluation include an IQ evaluation? The answer, it depends. If you're evaluating for autism, it may or may not include IQ testing. So if you have a school district that's doing this, look at your consent form and find out what you agreed to. If it's an ADOS, which is one of the autism specific evaluations, that is not an IQ test. So if it includes Woodcock-Johnson or the WISC or some other cognitive testing, that's one answer. So you have to look at what you agreed to and what the school is doing if it's a school district evaluation.
Can I jump in for 1 second? I just wanted to say, if anybody suggests they're going to diagnose your child by giving one test, you need to get another opinion. So like, I would never just give an ADOS and say, this is a student with autism. I would never just give an IQ test and say, oh, your child's brilliant, right? So I think that's important too, to know that you need more than one test.
The next question, we have a child who's doing fine, not on the school's radar screen because the grades are okay, but is struggling in school. I always advise parents, ask for an initial evaluation, meet with the teacher, meet with the school administrators, and if we all agree on a plan, a path forward, an initial evaluation of the areas of strengths and weaknesses, that's how we will determine, because grades alone are not the sole determining factor as to whether or not a child is doing well in school.
Yeah, sometimes we'll have our students actually keep their own data, and we'll say, you know, I want you to track the number of times that you couldn't finish the work, or I want you to track how long you spent on papers. And we get them involved in the data keeping, and that helps them learn how to self-advocate as well.
Yeah.
And our last question for the evening, we have a child whose triennial evaluation is due in May. And apparently the school district is doing, quote, full-blown testing. And the parent wants to come in with a private evaluation so they can be prepared ahead of, I guess, the PPT meeting. Is this a good strategy, is the question.
So this is a sort of complicated answer. If the school is in the middle of doing a triennial evaluation, that student should not also be seeing a private psychologist for an evaluation. So like, I always ask the family, if it's a child who has an IEP, when was the last evaluation? Send it to me. Are you in the process of starting a new one? Because we don't want there to be any overlap. I think that the other thing that can happen is that, let's say my child is coming up on a triennial and I know the PPT is in 5 months and I want to get a private evaluation first. I think that that's actually a really good strategy, because then the kid is pulled out of class less, it's more comprehensive, and then you can go into the PPT and say, hey, here's the information we have. So it's depending on what part of the triennial stage you're in, I guess that makes a difference.
To go back to your suggestion before, that you can't, or some tests you can have to wait a period of time before you revisit them. So you want to make sure that you're not sabotaging one by doing it concurrently with the same or similar at the same time too?
That's important because the way I understand it, you have to wait 1 year or 2 years, depending on the standardized test, before repeating it. You can use different standardized tests, but you can't repeat the same testing. So it's important to discuss with a qualified professional, school psychologist, private psychologist, so you understand the sequence of testing, if there's a waiting period, et cetera. So I think with this being the last question, I want to thank Dr. Cashman and Laura for joining us this evening, giving us a very informative presentation. Somebody asked, are we going to get the slides? Yes, they'll be sent to you with a recording. Jane and I will continue to keep a watchful eye on special education issues in this still never-ending pandemic that we're in and the impact. So I want to thank Dr. Cashman and Laura Noonan. Please give your own closing remarks after I finish and Jane finish. We will have a Zoom webinar in May. The date is to be determined. What we didn't realize is many schools are on vacation this week or last week, so it was hard to pin down the guests, but we are planning a topic on finding the right environment for learning and learning at special education schools. So we'll have more information that we'll be posting. If you're joining these conversations, please do not hesitate to register in the chat area before you sign off. Probably most important, I want to thank my daughter, Rachel, who's off camera to my right, because without her, we can't get these webinars off the ground. She's our producer, she's our IT person, she's your contact person for registering, and we welcome your questions. Check our Facebook page, mine, Jane's, our website at the Stamford JCC, the Law Office of Lawrence Berliner, and Facebook as well. So Jane, I will turn it over to you for some closing remarks, and then we can have Laura and Dr. Cashman conclude.
I'd like to thank Dr. Cashman and Laura Noonan for being with us tonight. It's been extremely informative, and it's great to know that these resources are local and encourage parents to look into them for their children. I think it's tremendous to have these opportunities to have access to different information. And it goes back to the first question, which was about collaboration and team working. And the more that you as parents can collaborate with those providing support and services to your children, share that information with the school districts, the more we can create this partnership so that we can see the child in their entirety and have a holistic approach to provide them with the right educational support and services within their classroom, not only just to support their academics, but also their social emotional experiences as well. So thank you for highlighting those topics tonight. It's been great. And I'd just like to remind people to check out the JumpStart Facebook page, which in addition to providing information about things that go on in the community, we also provide social recreational opportunities for you to come together, meet other parents in person in the locality. We have a cooking event coming up next Friday, I think, but keep your eye out for those opportunities, because as well as supporting your child, we'd like to support you, the parent, as well, and not only by providing you information, but giving you fun social things to do as well, because that's important for balance in our lives. So thank you for joining us tonight. We look forward to seeing you next time. And Dr. Cashman and Laura Noonan, to you too.
Thank you, everybody. I hope this was helpful, and it's a lot of information, but I hope that it was helpful and useful for people.
Yes, thank you so much. I really appreciate the opportunity to get to contribute. It's been a wild couple of years, and I'm so glad that it's bringing people together in this way. So I'm glad we're building more community. It's been one of the better things to come out of this period. So thank you so much for inviting us.
That is especially true. So thank you all. Stay healthy. And for those who are joining us next month, we'll see you sometime in May. We'll have the details coming out. Jane and I will send our emails or contact information about the next webinar. So we thank you both. And Jane, good night.